cancer. And more recently, he has also made major contributions in the identification and characterization of the innate lymphoid cells. He has over 370 publications.
And working as a center for immunology in Marseille-Lumini. Okay, so what we've been doing facing the emergency of the COVID pandemic is actually to gather a group of very motivated people, comprising people from the Marseille Public Hospital, so from the Center for Immunology in Marseille-Lumini, in a federation under the auspice of Marseille Immunopole, which gathers all the people working in immunology in Marseille to try to understand what's in the presence of SARS-CoV-2 infection. So what we know is that most COVID-19 patients present only a few mild stage of them, 15% roughly, progress to severe pneumonia, and about 5% develop acute respiratory distress syndrome that I will call ARDS for the remaining of the pneumonia, or ARDS, have to get some therapeutic strategies, and these were. So we know that the immune system plays a dual role in COVID-19. It's contributing to virus elimination in the first phase of this disease, but it also contributes to ARDS development, as I said, we set up this large with the aim of characterizing with some depth, obviously, the immune response occurring during disease progression from the mild to severe forms, and I will update you on that study. And the idea behind that was actually to evaluate whether it was possible to be available, either because they are approved or because they are available in clinical trials for fighting these T2, which is day 10 after enrollment. And so, as you can see here, we had 10 healthy controls, 10 paucisymptomatic COVID-19 patients. All the data will be in blue for this cohort of patients. In some of these patients, actually not all of them. You can appreciate that the seroconversion was in green, or with ARDS in red, but it was much lower, the detection of antibody. Now we had the chance to collaborate with our colleagues in Marseille, who are looking at not only at the antibodies against SARS-CoV-2, but also antibodies. And as you can see, one could really detect seroneutralizing antibodies in almost all, actually all ARDS patients, most of pneumonia patients, and a substantial fraction of paucisymptomatic. Really recapitulate what we know about the antibodies which are raised during SARS-CoV-2 infection. Now let's look at the lymphoid compartment. COVID-19 is associated with a severe lymphopenia, which associates CD NK cells, CD8 T cells. This lymphopenia is somewhat commensurate to the severity of disease, and those results, this part of the results regarding compartment is impressed in cellular and molecular immunology will be available very soon. But we were more concentrated on other aspects in one cascade. But before going into that, I would like also to show you that we here also recapitulate what we know about the famous during COVID-19, in particular in patients with ARDS. And you can see by looking at IL-6, PXCL9, this is indeed the case. We also monitored the C-reactive protein, which is very important, that we should include the monitoring of the complement cascade. But more than that, as I told you in the introduction, as our aim was also to find out whether it was possible to repurpose, to reposition in the context of COVID-19 some molecules, some drugs which are already available, and as Innate Pharma is developing an antibody that blocks the C5a-C5aR pathway, it was obvious for us to focus on this pathway. So I remind you that there are three pathways to activate the complement. You can really appreciate here in red, orange,